Welcome back. The current topic we're dealing with this week is pharmacology for the heart. At this point, you should have gone through and reviewed the anatomy and physiology of the heart and have submitted to me your assignment in the Dropbox. And now we're ready to talk about the specific medications that deal with issues for the heart. What you're going to find is this is divided into 3 lectures. The first dealing with cardiac glycosides, and that's the topic of this particular slideshow. The objectives for this section are to list and define the primary disorders of the heart, to name and describe the function of a common cardiac glycoside, describe 5 adverse effects of cardiac glycosides, and to differentiate between digitalization and maintenance in relationship to drug administration. Remember that whenever you're given a list of objectives, these are the key points that you should be extracting from your materials for the module. So it's a good idea to have these on hand and then review them as you're studying. If you're uncomfortable with one of them, make sure you go back and spend some more time on that particular objective. So before we actually talk about the medications, just want to review some information on some of the cardiac disorders that we're going to be dealing with when we are prescribing medications for the heart. So my first question for you today is, what is CHF? There are 2 ways that this acronym is defined. The old method is that of congestive heart failure, and the newer terminology is that of chronic heart failure. Either one would be correct, but the chronic heart failure tends to be more of what we're hearing today in current medical practice. And in this case, chronic heart failure is the inability of the heart to pump enough blood supply to the tissues and the organs of the body. That left ventricle just cannot get enough blood out to the tissues of the body. And therefore you start to see the issues of someone being short of breath, having difficulty walking up steps. Any type of activity can make them weak and tired because their heart can't get enough blood to their tissues. In addition, blood tends to back up then into the pulmonary circulatory system, and as a result further increases their difficulty with breathing. So in a nutshell, when we're talking chronic heart failure, we're talking about an issue with that left ventricle not being able to pump out enough blood. As you can see in our picture, when you look at that, also what happens during chronic heart failure is that left ventricle gets thickened. It's called hypertrophy. It gets enlarged. And as a result, that also allows less blood to accumulate and further decreases the amount of blood that can be ejected from the heart in any given squeeze. The second common disorder that we deal with in cardiology is that of CAD. And what's CAD? Coronary artery disease. Coronary artery disease is that case, as you see in our picture of B, whereby the arteries become blocked, and we're talking specifically the coronary arteries that supply blood to the heart. They become blocked usually by fatty plaques, and then sometimes eventually a blood clot comes in there, blocks what little space is there, and now we have ischemia. Oxygen cannot get to a part of the heart. Ultimately, it causes pain, which is called an MI or a myocardial infarction. Which then brings us to our next topic of what it causes angina or angina, depending on where you come from. And angina is that specific pain that we feel in the chest when Oxygen is not getting to the heart tissue. So the cause of angina is lack of oxygen to the tissue. Lack of oxygen to any tissue will cause pain and eventually tissue death. The last disorder then we're going to be primarily dealing with here in our cardiology piece is that of an arrhythmia. If you recall from your medical terminology, A means without, and then we look at the rest of the word, rhythmia, rhythm, it's without rhythm. In this case, we are talking about a heart that is not beating in that normal sinus rhythm as was described in your conduction video that we discussed. So we're going to look at medications that deal with all of these issues regarding cardiac disorders or cardiac disease. Okay, so the first disorder we're going to look at dealing with is that of heart failure, or CHF. So what are the causes of heart failure? The most common causes that we see for heart failure, that CHF, is untreated hypertension, myocardial infarctions, and problems with the valves, so valvular defects. Those are the three primary reasons that we will see people go into heart failure. And if you recall from your human illness and disease course then, what are the signs and symptoms that we see with individuals who are experiencing CHF or heart failure? And we talked a little bit about that before. We see someone who tends to be tired. They have issues with shortness of breath. They fatigue. They get tired out very quickly with activities. They may tend to have a rapid heartbeat because the heart is trying to beat faster to get blood out. We'll see peripheral edema, and that's swelling in particularly the feet and sometimes into the hands and fingers. And then we'll also see pulmonary edema, and that's that backup of fluid into the lungs, and it's blood that's congesting the lungs, unlike a pneumonia where it's other fluid inside the lungs. It's blood congesting the outside of the lungs, which then makes it difficult for someone to breathe. Medications that we typically use to treat chronic heart failure include the four following classifications. Now, as we are going through our medications, what I'm going to give you is the common classification for the medication. What you probably discovered already in doing your drug summaries was that some medications may fall under more than one classification, or different references will consider a medication under different classifications. The classification is that broad umbrella name that we give so that we can compartmentalize medications when we talk about them. We have billions of medications out there, and if we don't somehow come up with a system of classifying them into different groups, it becomes almost impossible to talk about them. When we talk about a classification, we're talking about medications that have similar properties. So if you remember the classifications of medications, you will remember general side effects, general actions, general routes, things that are general about those medications that will apply to almost all those medications. Though individual meds in that classification may have some specific things that they will deal with, they all have these general things that are familiar to them. Similar to when we did classification in biology. We say, we classified mammals, and all mammals had these similarities, and we classified invertebrates, and they all had these similarities. That's a similar thing we do with medications. So, as I said, you may see more than one classification. Remember, as we're going through here, though, to jot down the classification that I'm giving you for the medication. If you can remember the properties of the classification, then even if a new medication comes out, if it's still this classification, you are already going to know a number of things about the new medication because it applies to all the meds in this particular classification. So the first one that we're going to look at is going to be cardiac glycosides, and we're also going to take a look at beta blockers. The other two on here, vasodilators and diuretics, we will go over. They are used to treat CHF, but they actually fall a little better under next week's unit, which is that of vascular and renal medications. So we're not going to deal with those today, but we will be dealing with those next week. So we're going to take a look first at our cardiac glycosides. So now my question, a little bit about the history of medicines. Medicines come from a variety of different sources. They can come from animals, they can come from plants, they can come from the earth, they can come from a laboratory where there are a bunch of chemicals that are put together. Most of our medications, our oldest medications, came from plant sources. And I will tell you that the cardiac glycosides come from an old plant source. They come actually from a plant called digitalis, or the foxglove plant. And I have a picture of it down here in the corner. If you ever get a chance, a side note, to take a trip, there's a place called the Mutter Museum down in Philadelphia, and they have an herbal garden down there, medicinal herb garden. And each of the plants in there are used to make one or another kind of medication. It's kind of cool. But me, the geek, likes to see that stuff. So back on track. So cardiac glycosides come from the digitalis plant originally, or the foxglove plant. And what they do, or how they work, is they actually increase the force of contractions. They make the heart beat harder, so it puts out more blood in every squeeze. By putting out more blood, it improves circulation and it improves kidney function. So they work by making the heart squeeze harder, restoring normal blood circulation, and improving kidney function. So that is their overall mechanism of action for a cardiac glycoside. Now, the next question is, though, there are some things that we do have to watch with cardiac glycosides, and that would be serum potassium levels. And serum potassium levels have to be watched closely when someone is on a cardiac glycosides. A low serum potassium, known as hypokalemia, makes the heart more sensitive to digitalis. So many of our cardiac patients are also taking diuretics. Again, we'll get into that a little bit more next week. But diuretics, unfortunately, may pull potassium out of their body when they're pulling water out. So as a result, that can decrease their potassium levels. So what we have then is we have someone whose potassium levels are low, and as a result, now they are more sensitive to the medication, and they can very quickly become toxic. That term meaning getting almost that poisoning effect from the medication. And that can lead to something called VFib, ventricular fibrillation, and death. So it's important that we keep an eye on their serum potassium levels. Some of this information you may recall from a particular medication that you looked up on your drug summaries, and that would be the medication of Lanoxin. Lanoxin was a cardiac glycoside. So all the things that we're talking about here would apply to the medication of Lanoxin. So when you were researching Lanoxin, you should have found out some information about what a pulse rate has to do with this type of medication. Cardiac glycosides will slow down the pulse rate. By making the heart contract harder, they make it rest more in between, build up the action potential in those muscles so that it can squeeze harder. So as a result, the pulse rate will slow down. Um, in addition, it helps out because then the heart actually expends less oxygen each time it contracts. So it kind of has a nice dual-fold purpose there by slowing the heart rate down. And we also said that many people with CHF have a rapid heartbeat to begin with. The care that we have to do though when we're taking care of this patient or when this patient goes home is they do need to monitor their heart rate, and their heart rate needs to be greater than 60 beats per minute. If the heart rate is less than 60 beats per minute, we may need to withhold the dose, or we may need to look at changing the dosage because we are risking the possibility of slowing that heart rate down too much, and we're risking the possibility of toxicity from the medication. So thinking about the things that we just talked about, what would be some of the dietary concerns that we would have with someone who was taking a cardiac glycoside? Well, if you recall what we talked about with the last slide, potassium. We've got to keep an eye on potassium, and particularly we want to keep their potassium levels up so that we don't risk hypokalemia. So we want to make sure that they are getting nutrient-rich foods in potassium. Some of the sources of that would be, bananas, fruit juices in general. Many fruits have high potassium, and if you can put it in a juice, particularly I'm looking at a population of people who tend to be a little older and they need to keep up their fluid intake, etc., the juice is a really good choice. Vegetables are another good source of potassium. And then, of course, if we've got someone whose potassium's low and we are not able to sustain it with normal dietary intake, we may use potassium supplements. Unfortunately, I will tell you something about potassium pills. Potassium pills are huge horse pills and hard to swallow. So I would really try hard to get these people to eat fruits and veggies and drink juice in lieu of the potassium pills. And so at this point, you should be able to tell us some side effects. What are some common things that we would see on someone who is on a cardiac glycoside? And referring back to your drug summary that you did on the Lanoxin, you should have picked up a number of those common side effects. In which case, the most common would be nausea, vomiting, headache, visual disturbances. Sometimes they'll complain about floaters and things like that in their eyes. And cardiac arrhythmias. We may see someone when we start them on cardiac glycosides now start to have some rhythm issues with their heart. So those would be the most common side effects that we would see, adverse effects. May be able to manage them with some dosage regulation. May over time, if it's the nausea thing, taking them with food and doing some things like that over time may subside. And then that last question, to give one example of a cardiac glycoside, Lanoxin would be one, which you already researched, and a second one would be digoxin, um, which is another form of the same medication and is also a cardiac glycoside. Now, we spent a lot of time talking about with this particular medication discussing toxicity. It is important that we do monitor blood levels of this medication. In addition, there are two terms that come along with this medication that we don't see with other meds, and that is the term of digitalization. Well, actually, that's the only one that's specific to this. Maintenance comes along with our other meds, but digitalization specifically is something that we use with digitalis preparations, digoxin and lanoxin. Digitalization is a loading dose that we give. And what that means is we are going and we are trying to establish an initial blood level very quickly on this person. So we will give them an initial large dose, which you might think normally would be toxic, but because they have none in their system, we can give them a larger dose to quickly bring the blood levels up to where it needs to be. And then we continue them with a maintenance dose. And the maintenance dose then is that continuing dose that maintains that blood level so that the heart continues to contract as we want it to. If you've ever taken prednisone and done the prednisone whereby you get the large dose and then you taper it down, it's a very similar idea, except we just call that a loading dose. Digitalis is the only one where we call it digitalization. So digitalization is that initial loading dose, getting the blood level up as quickly as we can, and then maintenance is the dose that we use to keep the blood levels sustained throughout the rest of the person's life. So with that, you should have a good idea of what the common disorders are that we're going to be dealing with throughout the pharmacology of the heart, and be able to have now wrapped your head around the classification of cardiac glycosides.